Hello, everyone. Today we're going to talk about should professionals observe clients through a webcam in home and school environments and implement programs remotely via telehealth or telephone or webcam. My name is Ethan Wiley. I've been a registered behavioral technician at a nonprofit for 3 years in Illinois, and I'm on my way to hopefully becoming a board certified behavior analyst. And then everyone else is going to introduce themselves now. Brianna?
Hi, my name is Brianna Sample. I've been a registered behavior technician for just over a year and have been a supervisee for 6 months, advancing my career towards becoming a PCBA at an autism therapy center in Frisco, Texas.
Hi, I'm Iriel. I'm from Indiana. I've been a registered behavior technician for 3 years. I've been in getting my supervision since January, and hopefully I will be done in testing by next summer.
Hello, my name is Annabelle, and I'm also from the Indiana area. I have been in the ABA field for a little bit over a year, and I just started my supervision at my current company. And I'm hoping to get my hours and then progress my career towards being a BCBA in the next year or two.
Hi, everyone. My name is Allison. I've been in the master's program at Ball State since last spring. I am hoping to be done my supervision program by July, and I am hoping to eventually become a BCBA. I've been a registered behavior technician for 5 years now, and should be taking my boards by next September.
We actually had one of our group members drop their class at last minute, so Allison and Annabelle have volunteered to take over that person's portion of the debate. So Annabelle might be going back and forth between the pros and the cons. Um, okay. Technology in ABA is ever changing. Today we will be discussing the pros and cons. Um, Both sides have provided valid and important points. We will be discussing the that we'll be discussing along with ethical considerations. Our debate will start with the pro side, and then the cons will have their chance to do a rebuttal. And then once we get through all the pros and the cons rebuttals, then we'll switch to the cons main points, and the pros will have a chance to do their rebuttals. But before we get started, we're going to discuss some potential ethical considerations and biases. Brianna, do you want to start?
Yes, an ethical consideration and center member giving ABA services is the data breach on a telehealth program. It is easy to be leaked, and it is how to keep the data safe and like if say an internet connection's not working or your computer got scammed or something, and also whenever a therapist is going, how a therapist goes to observe and a client is the center, like they can't be out in public at a Starbucks or something, and because the other people can see and they're breaking code.
To touch on some personal biases that may interfere with professional activity, we can just start off with the personal bias. That's when our own life experiences might influence professional decisions instead of relying on client data. There's also a technology bias that may happen, which is when a provider may favor in-person services over telehealth or even vice versa, which could prevent a provider from evaluating the best format for that individual client. There's cultural biases that may happen, as it's possible to view a client's family traditions through the lens of your own background, which could lead to unfair judgment or misinterpretation. There's an aspect of socioeconomic status biases, and this could be when a provider is making assumptions about a family's level of commitment based on their financial situation or status. There's the disability bias, and that's when a provider may presume limits on what a client can or cannot achieve due to their diagnoses rather than looking at their individual strengths and the progress they've made. And lastly, there's an aspect of age bias where a provider may expect and also dismiss certain skills or behaviors due to that client's age or forgetting about their developmental differences.
To tie in the seven dimensions of ABA into telehealth, when coaching, training, or observing a session through telehealth, it's important that the conceptual system is understood by the caregivers and parents of the client. If a behavior analyst spoke to a parent using mostly behavior analytic terminology, it is more likely that the parent may misunderstand or not comprehend what's being explained to them. causing feelings of confusion and uncertainty when implementing interventions. During a telehealth service, it should be prioritized that the behavior analyst does not put the clients nor caregivers in situations that can cause harm. For example, if the client has a history of eloping, we should not direct the parent to generalize the implementation of the elopement intervention prior to evaluating a data and determining the client is ready to take the next step to generalization.
All right, now we will move on to our main argument. I am going to start with the first pro, and then we will keep going. So my first pro is telehealth expands access to ABA as it removes common barriers such as geography, scheduling, provider shortages, and making high quality interventions available to all families. So telehealth, or one of the biggest issues with the spread of ABA is accessibility. Telehealth is a great way to help expand across geography, scheduling conflicts, and provider services. Pollard et al. 2017 says that rural and underserved communities or underserved areas have said that their biggest priority is to have quality health care and that geological um, locations was the primary influence on their access to quality services. Romani and Shields 2017 talk about how hard it is to find services in Iowa in 2015. They state that out of the 99 counties, 78 of them are considered to be rural, and there were only 74 BCBAs in the entire state of Iowa. This means that some families have to travel up to 340 miles just to receive services within their state. This can result in a very large cost to receive services. In addition to just rural underserved areas, Pollard et al. 2017 said that telehealth has also been helpful to utilize bilingual citizens, or been helpful for bilingual citizens to use. Having access to bilingual clinicians helps more clients get access to services that you may not have been able to provide services to before. Uh, Even though that there are the 99 or there were only 78 BCBAs throughout the entire state. Some of the services aren't great in their areas. I actually have a client that lived like an hour away and would commute every single day to us just because they wanted to get quality services. Um, and that is my point. Allison, do you want to take away your counterpoint?
Sure. So in order to counter your statement, Ethan, that telehealth expands access to ABA, there's actually evidence that says otherwise. According to Yang et al. 2021, he conducted a study using telehealth in early intervention. During this time, they looked at the perception of telehealth from 9 focus groups, and I found that the perception that is most imperative in relation to geography is access to high-speed internet, where they found that 27% of the participants did not have access to the internet, and 14% of participants did not have access to high-speed internet. As someone who grew up in a more rural area, getting access to reliable internet has been difficult until recently. Another example, another thing to note from the Yang et al. Article is the preference for in-person visits. This means that even if someone has access to online services, they may prefer to travel to receive services. They also found that a lot of families, which included 84% of families in the study, had never heard of telehealth before. Even though the families may like telehealth, rural areas may not even know that it's an option. Annabelle, I think you're up next.
Alrighty, so for the next pro, I'm going to be discussing how telehealth ABA offers cost-effective and efficient alternatives compared to in-person services as it reduces expenses for families and organizations while still maintaining strong treatment outcomes. Ferguson and his colleagues.
Which visual is yours again?
Mine is near the end. It's the cost analysis. It has my name on
Okay.
it.
Okay.
Yep, there we go. Ferguson and his colleagues in the year of 2022 showed that telehealth ABA parent training can be just as effective as in-person services, but at a lower cost. In their study, the parents learned ABA strategies through online coaching and were able to use those skills to help their children improve communication, such as making eye contact and demanding for different requests. Parents also said that the training was helpful and more affordable, as the cost analysis confirmed that telehealth was cheaper than in-person ABA. Fisher and his team in the year 2020 ran a randomized clinical trial showing that telehealth parent training not only boosted caregivers' confidence, but it also led to long-term improvements in how parents use ABA techniques in their children's behavior. Together, these studies show that telehealth isn't just convenient, but it's an effective and financially sustainable way to make ABA services more accessible to families. Looking at the chart visual, this cost analysis clearly shows that telehealth provides significant financial savings compared to the traditional face-to-face service delivery. By removing both travel time and mileage expenses, telehealth reduces overall project costs for both organizations and professionals. If you look across 5 participants, the telehealth model saved a total of $7,546.70, with individual savings ranging from $448 to $2,639. These savings can also grow larger as distance increases, showing that telehealth is not only more economical, but it also can be more scalable and sustainable for long-term delivery service. Thank you.
The counter to that is the telehealth ABA offers cost-effective and efficient alternatives compared to in-person services as it reduces expenses for families and organizations while still maintaining strong treatment outcomes.
For my last pro for the pro side, telehealth strengthens parents' skills and confidence while promoting positive child outcomes, providing real-time feedback, and helping caregivers build competence in applying ABA strategies that lead to positive outcomes. I want to reference the following parent testimonial from the Chung et al. 2022 article. Providers have made me become more hands-on with my daughter. Instead of having someone sit in my home and work with her, I'm working with her through instructions. It's made me a lot more comfortable doing that throughout our entire day instead of just that hour we're on telehealth session. Telehealth services help not only the direct recipient of services, but also their families and caregivers. Being able to provide in the moment feedback to parents helps promote more effective treatment and more opportunities for buy in from parents. If a parent were to implement an intervention incorrectly, they could cause unintentional harm to their child. One barrier that commonly emerges parents is not understanding the purpose of an intervention, how to implement the intervention, and confusion about terminology within the intervention. Boyson et al. 2023 addressed these issues by conducting comprehensive skills and knowledge assessments with parents before, during, and after intervention implementation. At the baseline, the parents demonstrated an average of 7.7% for comprehensive skills and 39.3% for knowledge. At intervention, the average percentages increased to 88.5% and 74.3% respectively. By the end of the intervention, the average remained higher than the baseline with 87.8% in comprehensive skills and 76.3% in knowledge. As shown in Table 4, the average gains were found to be 80.9% in comprehensive skills and 35% in knowledge. This data emphasizes the significant impact of parent training and in-the-moment feedback provided during telehealth session.
The Chung et al. Article in 2020 was able to counter the concept of telehealth strengthening parent skills and confidence while also promoting positive child outcomes and providing real-time feedback, which also helps caregivers build competence in applying ABA strategies that lead to positive outcomes. So during the Chung et al. 2022 research article, the theory of ABA telehealth sessions having a positive outcomes for parents and their children was tested. While the article did display that some parents have a positive experience in increasing their confidence while applying interventions coached by a BCBA via telehealth, there were other parents who reported challenges during this time and their experience. More specifically, parents mentioned that trying to de-escalate their child's problem and maladaptive behaviors while simultaneously following directions from the therapist was difficult. Parents can become discouraged while trying to implement hands-on procedures and interventions that they have never visually seen before and have never seen BCBAs carry out themselves. this can decrease their confidence while attempting to apply interventions that a BCBA is describing how they should do it through a screen during an ABA telehealth session. And this can also decrease the intervention effectiveness and lead to negative outcomes of applied behavior analysis telehealth sessions.
All right, now we've gone through all of the pro side, and we're going to move on to our cons main arguments. I will go back on the PowerPoint so that way we can see where all of the con are main arguments, and we will start with Annabella.
Alrighty. To start off, for the first con, if you wouldn't mind, Ethan, going to the social capital theory visual. Yep. Just to look at what social capital theory is, it's a sense of belonging, different networks, diversity, values, norms, and outlooks in life. It's participation and feelings of trust and safety, reciprocity, and then also the aspect of citizen power and proactivity. The first con that I'm going to be discussing today is that social capital theory emphasizes how community connections, trust, and social networks influence people's ability to access and benefit from resources like telehealth. In early intervention, these factors can create barriers for family who have fewer supports or limited socioeconomic resources. Yang and his colleagues in the year 2021 found that families' experiences with telehealth really varied depending on their access to technology, the reliability of their internet, and how comfortable they were communicating online through online platforms. Families who had limited social support or who were under more financial strain often struggled to participate in the way they thought they should, which created unequal access to early intervention services. In other words, telehealth, while it's convenient, can unintentionally widen the gap by favoring families with more resources and stability, whether that be financial or just the convenience of hopping online, depending on parents' work schedules, different aspects like that. However, for families who do have reliable access, telehealth offers meaningful flexibility and it allows them to schedule services around their own routine and needs, which can make participation more manageable and consistent. But we have to be careful to make sure that families do have the resources. And one of the big issues seen in telehealth ABA therapy is that some families do not have the resources to join online, whether that be something like just computer, internet, and so that's something we have to keep an eye out for as different, every family has a different situation, so telehealth might not look convenient for them.
To counter that, Boydston et al. 2023 found that using telehealth services benefited families from rural and or lower social economic backgrounds. For most people living in rural areas, ABA services typically requires families to travel longer distances or rely on public transportation to seek services for their child. Over the 6-month duration of the study, the participating families saved between $864 to $2,087 on travel expenses alone. An additional advantage to using telehealth, families no longer need to seek childcare for other children because services are delivered in-home. So the whole family could be in the in-home without that expense of finding childcare. Chung et al. 2023 discussed advantages of telehealth that included eliminating service wait times, and greater schedule flexibility. For families who prefer their child to seek in-person services, they have the option to remain on the wait list at whatever location that they're looking for, but they can continue to seek services through telehealth in the meantime.
Hi, I'm the second con. I will be talking about the use of telehealth imposes on HIPAA laws. Supervision is a core component of the professional life of an ABA specialist. It takes a lot of work to follow the HIPAA privacy law and keep the ethics of ABA supervision. This means following the best standards for ABA therapy and documentation, routinely training personnel on both ethical and HIPAA compliance, like when you're being supervised by your supervision by your supervisor. Another important thing for providers is to have a plan in place when data breaches happen, which can be at any moment during the day randomly. This action strategy should include steps to contain the breach, who to notify, how to investigate thoroughly to find out what caused the security breach, and how to prevent it from happening in the future. Healthcare providers must also follow the security rule, which says that all electronic PHI must be protected by data, encrypted, strict access codes, and regular security checks. If a breach happens, the breach notification rule says that the providers must tell the people who were affected. So you would contact the parents first and your BCBA and all that. The Department of Health and Human Services and sometimes the media. Keeping up with the latest news and best practices in the field is important. Getting HIPAA's certification and talking to professional groups and legal experts are two ways to make sure that patient health information is kept private and safe as possible.
All right, and I will be providing the counter argument to that. Pollard et al. 2017 mentioned that there is software that is HIPAA compliant and allows for two-way video and audio between the BCBA and the RBT that are secure. Romani and Schiltz 2017 mentioned a few services that are compliant with both HIPAA and FERPA, such as Adobe Connect, Video, VC, and HIPAA Chat. Along with ensuring that you use a secure video audio software, Pollard et al. Say that you also need to make sure that you're using encrypted websites for recording and storing data, encrypted emails, faxes, and messaging systems as well. By implementing these secure systems, you don't have to worry about violating any of the HIPAA laws and guidelines without compromising client confidentiality. This also helps increase access to high quality behavioral services, especially in rural and underserved areas. This Romani and Schiltz table that I found from the article shows different ethical codes and then the themes that go along with it. So the first one or some way there these all show some ways to adapt tel um, ethical guidelines to the telehealth model and shows that some things could be easier to do even over over telehealth, like the getting consent to participate in services, to go over contracts and fees and financial arrangements. It could also help with interrupting or discontinuing services. So if I had a client go on that had to go on a family emergency, and using telehealth would have been able to have us help the family if anything comes up while they were gone for a family emergency. Um, and it helps with being able to communicate with families easier and maintain contact with them. So I'll pass it on to the next con.
Okay, so the third con that we are going to be discussing is the use of telehealth facing barriers such as technology issues and client safety issues that tend to arise. Ethan, do you mind going to the ninth slide for me?
Oh,
Thank you.
oh, sorry.
You're okay. So in this article, it represents a visual presented by Bombs and Araba 2020. It represents a checklist of ethical services that need to be required during an ABA telehealth session. Some questions that consist on it are, is the client physically safe during telehealth sessions? Is the environment safe for the child? And this is a variable that cannot be controlled as a BCBA. A practitioner can only verbally explain and give directions to a parent or a stakeholder of how to manipulate the environment where the session is taking place to ensure the client's safety. So, to add on to that, in the Ferguson et al. 2020 article, some individuals raised concerns that telehealth comes with technology problems and safety concerns. Though some research studies showed that these issues can be worked through, parents still feel more comfortable with the idea of a licensed BCBA, ABA therapist being able to physically show them what to do in a crisis situation and during an intervention, which cannot happen during a telehealth session and is a barrier that ABA telehealth carries. Ferguson et al. 2022 article showed that while some parents were able to learn ABA strategies through telehealth and use them effectively, others did not feel fully comfortable carrying out these interventions from video guidance. In addition, some parents mentioned that they felt more comfortable handling situations where a practitioner was in the room with them in order to prevent safety issues while implementing ABA services with their child. Similarly, Fisher et al. 2020 mentioned how parents also issued concerns about technology issues occurring during a session, which would then put the client at risk if interventions are not being implemented correctly, since they would not have any communication or any contact with the practitioner if there is a technology issue.
To counter Allison's con, that the use of telehealth faces barriers such as technological issues and safety issues that arise. Some people might worry that telehealth may cause tech problems or safety issues, but research actually shows that these concerns can be managed and the benefits outweigh them. For example, Ferguson and his colleagues in 2022 found that parents were able to learn ABA strategies online and use them effectively, leading to real improvements for their children. Parents said that they even felt more confident handling tough situations, which actually reduced the chances of unsafe mistakes since they weren't left second guessing what to do. Similarly, Fisher and his colleagues in 2020 showed that telehealth training gave parents the knowledge and skills they need to apply ABA strategies correctly and safely into their children's daily routines. So instead of creating risk, telehealth ABA can actually increase safety by letting caregivers practice in real time with the BCBA experts' feedback right in their home, the same place where these behaviors often actually happen.
All right. Um, I think we have some questions that we wanted to go over. Does anyone want to start with any of their questions?
I can go. So these are some of the questions that families and caregivers would probably have for telehealth and ABA services. Very commonly, my question that I thought of and all that for this topic was how do I look at the insurance coverage between the service of delivery in person versus telehealth and ABA field, and what insurance and levels of insurances cover the best for this program?
I can discuss one of my questions that I was also wondering about. In what ways does telehealth ABA reduce costs for families and organizations compared to in-person slash traditional services? And I actually had my pro on this on how it's very cost effective, but also just looking at this in a general from a general standpoint, for families, virtual sessions eliminate the need for travel, as in right away you're saving money on gas, parking, and public transportation. Parents can also spend less time away from work, reducing lost wages and no longer need to arrange childcare for if they have siblings or anything. And some telehealth programs are even more affordable because providers have fewer operating expenses. And for organizations, telehealth can cut costs by reducing different overhead things such as rent, utilities, and materials that are needed for in-person services. And it also allows providers to schedule more clients each day as there's no travel time between appointments. Additionally, attendance rates tend to improve because families can join sessions more easily from home, helping organizations maintain steady revenue. And so it ends up being more cost effective and a more cost effective model that benefits both families and the service providers.
My question that I think families would ask would be how to determine whether telehealth or traditional in-person services is the best fit for the family. And I would say that would just depend on how the family operates. Everyone's family is different. So no one's able to fully determine that for you. I think it would be best to like look over your insurance companies, see what's best with your financial stability, how financially stable you guys are. Um, Other things like childcare, travel expenses, all those things kind of play a toll into deciding what's best for your family.
The question that I came up with was, what are some safety concerns that should be aware when you that you should be aware of when using remote observation compared to in-person observation? I think that it is, um, I think that it really is dependent on the learner, like whatever behaviors they engage with. If you have a learner that engages in like severe self-injurious behavior or like destructive behaviors, telehealth also might not be appropriate. I mean, if you if a BCBA or an RBT is not there to help support a family, they then I don't think ethically it would be very wise to have a to do remote services if you cannot be there to support the families, but also if you're more work using ABA um, to work on like communication and stuff, that might be something um, that could be more applicable. Um, yeah.
And the question that I brought to the table, that a lot of caregivers and stakeholders may have if they've never interacted or participated in a telehealth therapy session would be, what can I expect from a typical ABA telehealth session? Like I said before, there are a lot of clients and stakeholders and caregivers that might not know what a typical ABA session looks like, whether a BCBA is coming into the home or whether it's through telehealth. So they may not know what an ABA session tends to look like. If they've never participated in a telehealth session from a medical setting or a therapy setting, they might not know what to expect. So it's very important for a BCBA to be able to give them a format of what to expect during a session and how much prompting they'll be able to give them and how much advice they'll be able to give them for a session when they're trying to implement interventions that a BCBA is giving them in order to use with their son, their daughter, or whoever they're taking care of.
All right, and I think that this is a good place to go to or to conclude our presentation, our debate. Annabelle, do you want to
Yep.
conclude us?
Thank you. So overall, all in all, the debate whether to use telehealth ABA to observe clients and deliver ABA programs highlights both opportunities and challenges. Supporters argue to increase access for families in rural or underserved areas, lower costs, and the ability to provide parents with more hands-on guidance that builds both their confidence and skills in caring for their child. Research leads us to believe that these services can be just as effective as in-person services as they help families receive quality care without scheduling barriers or financial burdens. On the other hand, critics highlight important concerns such as HIPAA compliance, technological barriers, as well as the challenges families may face when trying to implement intervention through remote direction. Overall, ethical considerations need to remain central as providers must ensure patient confidentiality, safety, and equitable access while upholding professional standards. Telehealth should not be seen as a complete replacement for in-person ABA, but be seen as a valuable component in making sure those who need services receive them. When applied with careful planning and ethical protections, it offers families greater flexibility and the chance to receive effective support in a way that fits their needs. Thank you guys so much for listening to our debate today.